Hi there, I'm Dr. Gwanya-Mdletye. I am answering the question today of what to bring along to your first psychiatrist visit. So this is a chat. It's not medical advice. It's not a consultation. It does not replace your consultation with your doctor. So we're just chatting. That's all there is to it. And I'm hoping it'll be a helpful chat. So let's go. What do you bring along? So I think the first important thing you bring along is information. You come to the consultation equipped with a wealth of information about what you have been going through. And it's important to, in fact, let me say it can be very helpful if you give some thought through that information ahead of the visit, so that you have a way of relaying, firstly your own struggling, what you've been experiencing up until now, but also information regarding, the different times that you may have experienced struggle with your mental health and what has come out of that up until now. One important piece of information to bring along, which I always find interesting when someone forgets to bring, is your referral letter. A lot of the time, the provider, which is usually your general practitioner or a psychologist that has referred you, will have given you a referral letter to take to the psychiatrist. It's so important for the psychiatrist to have that referral letter, preferably ahead of time, but definitely by the time you see them. So the referral letter, any past reports that may have been made regarding your mental health. So this could be reports by a psychologist, by an occupational therapist, maybe reports for imaging that may have been done, imaging studies like CT scans, brain scans, maybe even blood tests that your general practitioner may have done leading up to the referral. So any past medical reports, any significant details that you might relate to your current struggle or even past mental health struggles. Okay, if you keep a diary, if you keep a journal, you could bring this along. I want to warn you though that don't get too disappointed if the psychiatrist does not necessarily want to go through all the details that are in your journal, because usually there are also time constraints. However, when there is pertinent information, there, it's helpful if you have it there, and you can just quickly page it through. So information is our number one of what to bring along. So the second thing I always encourage my patients to bring along is questions, right? I see myself, or I view myself as your psychiatrist, or as a psychiatrist, to be a collaborator in the patient's care, right? And I'm collaborating with the patient. So you as a patient bring along not only information, but questions that you might have about the condition that you're struggling with, questions about the treatment you're getting put on and its implications on your life and your livelihood. Questions that may pertain maybe to specific considerations. You know, you might be going to work and your illness may be affecting your performance at work. You might be a mom, right? A new mom that's breastfeeding, wondering how the treatment may impact your baby. You might be pregnant. You might be driving. You might be someone who drives professionally. You want to know if this information will affect, your level of consciousness, your alertness on the road. So I would encourage you to bring along questions that you might have pertaining to all these different and other considerations that you might be interested to know about how the condition and the condition's treatment will affect how you show up in the different areas of your life. Third thing that I would emphasize as important to bring along is either information about your medication or bring all your medication that you're taking. So this includes either psychiatric treatment and non-psychiatric treatment. So if you're on treatment for any other medical condition, bring that treatment along. You know why this is important is because it helps to plan your treatment better your psychiatrist to make more informed decisions about your treatment plan. So bring your medication. If you are not the person that takes the medication, so I know some people will have either, the partner, the wife, the husband give their medication. So the person that's responsible for the medication, if they are not there in the visit, it's important then to bring along how the medication is taken. All right. So all medication, bringing it along is always a good idea. Then there's the issue of bringing along a supportive or significant other. That is not a bad idea, especially if there are gaps either in your memory of how things have played themselves out in your life, or gaps in information itself. So if you don't have the information, if you aren't able to articulate the information, you feel that having someone else there could help to draw a clearer picture of what's going on. Most definitely bringing along that supportive other is always a good idea. Again, I want to make a proviso to say, if you do have a supportive other around, don't take offense if the psychiatrist asks to see you without that person at some point in the consultation. Sometimes it's helpful, to have the person for information, but then we're also able to get a bit more detail in terms of your current either struggle, your mental state, and so on, when another person is not in the room, or we feel that we might get a better picture in that person's absence. The reverse may also happen. So you may find that perhaps the psychiatrist might ask to get some information from the other person in your absence if it's going to be helpful, perhaps to alleviate discomfort, because sometimes it's uncomfortable to talk in someone's presence about them. These are different scenarios that may or may not play themselves out. All of this with your permission, particularly as a consenting adult. All right, so it's a supportive or significant other. It could be, something or someone to bring along. And then there's the, fifth thing would be, the practical things that sometimes we forget. Some of the information that you discuss in a psychiatrist visit can be quite emotive, and having tissue there is always helpful. I know I always have tissue in my consulting room, and a lot of psychiatrists do the same. But you may be in a setting where that's not the case. Right, so it's helpful if you do have some tissue for yourself along in your handbag. If you do have some water, whether bring along a water bottle. So practical things that will be helpful in bringing ease, should the situation get a bit too emotionally charged. And you need either a sip of water, or you need to wipe some tears. I sometimes will joke to my patients to say that, my consulting room, I chop onions sometimes in my consulting room, just in jest. But you can anticipate that at times, you may find yourself in that situation where you either become tearful. Sometimes tears of laughter, believe it or not, right? So practical things like that. So I hope this chat was helpful to an extent. If you do find it helpful, I'd love to know whether you like, whether you comment, whether you share the video that will be helpful to someone else. That's great. And remember, the whole reason I do this is because your well-being matters. So take care and God bless. Bye.